Morning everyone, Dr. Eric, the fitness physician, where I talk about all things related to hormonal fitness, muscle medicine, and more. I do basically health and performance optimization and doing multiple series each week on hormones, weight loss, living your best life, looking and feeling your best, optimize your health, making you look better, feel better from the inside and out. And that's what it's all about. So, I like quizzes. I'm gonna do another little quiz today because there's a lot of myths out there and I still come across all kinds of myths and old kind of sayings and practices, even from doctors and from trainers and from just lay public, pretty much everywhere out there. So, basically I'm going to talk a little bit about ED, not that ED, different kind of ED. I'm going to talk about that ED later, but today I'm going to talk about a different ED. So, so ED is not ED. So what I mean by this is estrogen dominance. So yeah, I hear this term all the time. A lot of people say there really is no such thing. Some people say there is. Technically there is not, but can you be more dominant compared to other hormones? Yeah, I guess so if you have too much, but how much is too much? That's a whole topic, but the bottom line is there really isn't a true estrogen dominance per se. You can have an imbalance of a hormone and compared to others. That's a very different thing. But basically this is not estrogen dominance is not estrogen dominance. It's actually insulin resistance. That's typically what happens. And where does this come from? Basically, you hear this a lot with women. We hear a lot in terms of weight gain, bloating, fluid retention, fatigue, irritability. Guys complain, oh my God. You hear about the trainers and even a lot of the doctors still say, on all the bro magazines and the bodybuilders in the fitness community, it's like, oh bro, you gotta get your estrogen down right. I got gynae. I got bitch tits. I'm retaining water. I'm moody. I'm emotional. Got to get that estrogen down. No, that is false. So. Number two, I'm going to talk about that in a second. Number one, gynae is a whole topic for another day, but that is not the issue. When people say they have gynae, what they mean is they're getting basically they're getting fluid, they're getting extra tissue. Basically, they're getting breasts, they're getting man breasts, they're getting man boobs, right? That's what they complain about. Again, that's insulin resistance. That's just sub-Q fat, right? That's all that is fat, and nobody wants to hear that because they're like, oh my gosh, it's estrogen. No, it's just fat. Because you're eating too much, you're eating the wrong things, you're not working out, you're inflamed, you've got some gut inflammation, you've got some other hormonal issues we need to address. I'm not saying there's other medical issues we need to address, but the bottom line is it's sub-Q fat due to insulin resistance, and that needs to be corrected. That is not gynae. True gynecomastia is pain. You get a painful lump under the nipple, and that does happen, and that's a surgical treatment, and that has nothing to do with what we're talking about today. It's not estrogen dominance, it's not too much estrogen. So that is false. And number two, this whole issue of this ED is not ED. It gets worse or better in menopause. The answer is it gets worse because a lot of people think that, oh my gosh, you got too much estrogen. It actually gets worse because you lose estrogen as you go through menopause. And interestingly, when you give estradiol back, bioidentical estradiol, this goes away. So you treat ED, you treat estrogen dominance with estrogen. I know it's very controversial, but it's true. Because if you look at head-to-head studies where you actually do it, it's called an interventional trial, you get those results, period. I'm going to talk in the future about this, and I could talk for hours about this. One of my mentors, Dr. Ruzier, discussed this at length, but the bottom line is you have an association study. Association, does that mean causation? Or basically, if you have a baseline study, that's very different from an interventional study. So if you look at men and women and they have X condition, for example, they have fluid retention, or they have heart disease, and they noted that they have a high estrogen level or a high testosterone level, and they think, oh, it's the testosterone that causes it. That's where a lot of these myths came about, like, oh, testosterone causes heart disease or estrogen causes heart disease. No, it's the underlying inflammation, it's the underlying health conditions like insulin resistance that caused it. It was those hormone levels are an innocent bystander. Because when you do an interventional trial, you have a patient and you put them on testosterone, you put them on estradiol, put them on thyroid, that condition gets better, and they get better, kind of like at menopause. When you give estradiol, this gets better. They lose weight. Women lose weight. They become less irritable. They feel better. They look better because you're treating the underlying condition with estradiol. Same thing with testosterone and thyroid. You're treating the underlying condition. It's called an interventional trial. So those are a couple of different myths that I wanted to bust today. So anyway, I will talk about this more in the future. Just want to throw that out there. I talked a little bit too much. I want to make this a short quiz. So anyway, reach out to me if you want to learn more. Comment in the post below what you would like me to discuss, and I will do so. Please like and share this post. Everybody remember, live to give. Do something nice for someone and pass it forward. Everyone have a rocking day. We'll talk to you soon.